Can you hear me?
Yes, we can hear you.
Great, thank you. So, are we on?
Yes, we are.
Excellent. So, thank you everyone and welcome. Greetings, I want to take this opportunity to welcome our speakers and all of you to this webinar to commemorate the International Day of the Girl Child. As you know, we celebrate the International Day of the Child on Sunday. And it's amazing to be here with these great speakers. My name is Cecilia Espinosa, and I'm a Senior Advocacy Advisor at Ipas. For those of you who don't know our work, Ipas works globally to improve access to safe abortion and contraception so that every woman and girl can determine her own future. Advancing the sexual and reproductive health and rights of girls and young women, it's even more urgent during the COVID-19 crisis. The pandemic has caused social isolation and has increased the risk of violence and exploitation, poor nutrition, unintended pregnancies, and rates of school dropout. Millions of girls will never return to the classrooms as previously had happened in other health crises like the Ebola epidemic in West Africa. Early data, it's already showing an increase on adolescent pregnancy. So during COVID-19, so there's obviously a lot that we need to do to make sure adolescent sexual and reproductive health and rights are fulfilled. We know that girls' sexual and reproductive health services and comprehensive sexuality education are often overlooked during emergencies. So this is why we're coming here today together to talk about how we can collectively advocate for policies and programs that support girls' sexual and reproductive health and eliminate unnecessary barriers. This webinar is organized as a conversation. We're not going to have formal presentations, but we want to have this conversation with our experts that we have here today. I'm going to introduce each of them, and after that, I'm going to pose some questions to our speakers. And we also going to have the opportunity for our audience to also ask questions to them. So please, take notes of the questions that you have for them. You can also share them in the chat box, and I'm gonna be collecting them, and also when we have the period of questions, I'm gonna be sharing them with the speakers. So I'm gonna stop here because obviously you don't wanna continue just hearing me with this long introduction. As I said, we have 5 amazing speakers today. These five advocates working with girls to advance their human, sexual, and reproductive rights. And I'm very happy that they all accepted to be here today with us. And to take advantage of our time together, I'm gonna introduce them so we can hear more from them. First, I want to introduce Aseata Sal, who is gonna be with us soon, trying to get online. Aseata is the program director for adolescent girls' rights at the Global Fund for Women. Aseata has devoted her career to young people, adolescent girls, and women. Her areas of technical expertise includes adolescent girls programming, gender-based violence, violence against women and girls, and advocacy and movement building. Aseata has extensive experience working on adolescent girl programming for multiple organizations, including the International Rescue Committee, in Sierra Leone, Girl Hub, Population Services International, and the Minister of Youth in the government of Rwanda. Here today, we also have Alexandra Parnevyor. She is the Sexual and Reproductive Health and Rights in Emergencies Advisor at Plan International. Alexandra has worked with adolescent sexual and reproductive health and rights at Plan International for the past 4 years, and is currently leading the development of Plan International's humanitarian work on sexual and reproductive health and rights. She provides technical support to a range of programs in acute and protracted crisis across Latin America, Asia and the Pacific, Sub-Saharan Africa, and the Middle East. And this year, she also have led a Plan International task force on COVID-19 and SRHR, and support country offices to integrate sexual and reproductive health and rights in adaptation and response plans in order to ensure that the sexual and reproductive health and rights needs of the affected population continue to be met during the pandemic. We also have my dear colleague and friend, Eugenia Lopez Uribe. She is the head of Latin America and the Caribbean engagement for Girls Not Brides. And Eugenia has more than 25 years of experience working in sexual and reproductive health and rights and health, gender, HIV, human rights, and youth in Latin America with rural, indigenous, and marginalized populations. She has extensive experience in advocacy and alliance building at the national and regional level. We also have Marina Pleasance. Marina is a consultant in the adolescent and at-risk populations team in the Department of Sexual and Reproductive Health and Research in the Global Health Organization. Marina works as I mentioned, in the WHO Department of Sexual and Reproductive Health and Research, and the UNDP, UFPA, UNICEF, WHO, World Bank Human Reproductive Program. In this role, she supports the WHO portfolio on work on adolescents and reproductive health and rights, including building the evidence base and supporting countries to translate this evidence into action through well-designed and well-maintained policies and programs. And finally, we have our very own Pansy Pam Katenga. She is the country director of Ipas in Malawi. And Pansy brings over 20 years of experience in international development, focusing on women's empowerment, sexual and reproductive health, measurement and evaluation, livelihood building, food and nutrition security, and commodity management in Africa and Asia. And prior to joining IPAS, she served as the country director for Christian Aid Malawi, where she was responsible for a program focusing on sexual and reproductive health and resilience building. So this is our great panel that we have today. And as I mentioned before, I will be posing questions to the speakers, and then we were gonna have the opportunity to gather some questions from the audience. So thank you again to this amazing panel. And I'm gonna start with Eugenia. So Eugenia, as I mentioned before, and as everyone knows, we celebrate the International Day of the Girl Child on Sunday. Can you tell us more about the importance of commemorating this important day, especially in the context of the COVID-19 pandemic, and what is the Girls No Brides analysis and perspective on the world right now? Thank you, Eugenia.
Thank you, Cecilia, for the invitation for this conversation, and hi, everybody, good morning. Well, I think that the first thing I would like to say is that we know that adolescents have been left behind, despite the fact that the Beijing conference highlighted in the girls chapter the relevance of addressing their rights and putting at the center. So that is why the International Day of the Girl is so important to visibilize the contributions, the voices, and the participation, the leadership that they do have in their communities and in the world. I think that we can all recognize that girls are leading the path. We have seen them in the UN, we have seen them in the communities leading and sensitizing us. And in the COVID epidemic, we are seeing them being the ones mobilizing for supporting their peers. They are the ones responding at the community level in the networks and making sure that her peers have hygienic products such as menstrual products or even access to sexual and reproductive rights and health. So we in Girls Not Brides are very aware of the needs that they had before, and then with COVID, these needs increased. I'm sure that my colleagues are going to present some data on this, but we know that the gender-based violence has increased, especially for girls that are at home. We know that with the closing of schools, they are at more risk of not coming back. We saw that happening with the Ebola pandemic. And we also know that because of the homeschooling and the working at home, girls are also having a more and a deeper burden to do care and domestic work. And these three things together and the economic impact that the epidemic is going to have an important increasement on the exposure to child marriage as well. We know that we have around 100 million adolescents in the world now, and from them 12 million get married each year. And UNFPA has estimated that because of COVID, we will have 13 million more getting married. So we see how the gender inequality, which is the structural driver of child marriage, together with these other four elements that I just mentioned, are contributing for girls to be at more risk of not fulfilling their dreams and have a development and to get access to the full sphere of sexual and reproductive rights, but other human rights as well as empowerment and development, no, professional and personal development. So we know that this is a complex issue and we know that we need to work together. So that's why we need to invest in the small community-led organizations and youth and women-led organizations that are at the front lines of the response. And we need to ensure that girls are participating in the decision-making processes of these policies to respond to COVID and post-COVID. We need gender justice in a new normality, finally, please. We need to work for it. Thank you.
Thank you, Eugenia. This is obviously very important, and continue with this. Obviously, you were mentioning a lot of the impact actually that is having on girls, and what are some of the strategies that your organization is implementing and proposing also. But now I also want to hear from Alexandra, and I know that Plan International also have been documenting the impact of COVID-19 on girls and young women's lives and well-being. Can you share with us some of the key findings from your research and your work with girls? Thank you, Alexandra.
Thank you. Yes, thanks everyone for joining today, and thanks for having us. Some of the things that Eugenia just mentioned has come up in our research as well, and as we've said and as we know, COVID-19 has had and continues to have a negative impact on girls' lives, and specifically girls and young women's SRHR. Some of the reasons that have been reported as obstacles during the pandemic include threats to supply chains, resources being diverted to COVID-19 infection prevention and control measures, threats and fear of visiting health service points and much more. And in addition to disrupted access to SRH services, what we've seen in our programs and what our research tells us is that disruption of schools and other social spaces has also led to girls not accessing the sexuality education that they would normally access through those platforms. So some of our research has shown that today almost over 40% of girls access all of their information about SRHR issues online or via social media. At the same time, we have done some research on the experience of girls online, which shows that girls from all over the world report experiencing harassment, threats, and violence on social media platforms and online. So negative experiences online and not knowing what information to trust, feeling overwhelmed with negative news about the pandemic, and not being able to verify the information that they find via social media or the internet in schools or through social networks and so on, really has a negative impact on their ability and position to make informed decisions about their bodies and seek health and healthcare and services that still exist in the communities. At the same time, we know that access to digital means and internet and social media is not equal, and men and boys generally have more access to internet and devices to access this kind of information. So that's another huge barrier for girls to access sexuality education and SRHR information. So really what we've seen in our programs and this research has shown that the COVID-19 pandemic really has a huge impact on girls' lives and girls' access to health and information. It risks setting back hard-won gains for gender equality and girls' rights. And I think that what's really key from now on is to take multi-sectoral approaches to figuring out this situation together and try and work in partnerships with adolescents, just like Eugenia was talking about. No one person has needs that fit in one sector, so programs and actions can't do that either. So whether it's a response to the pandemic and new activities or new initiatives, or if it's adapting existing programs on SRHR, including sexuality education, to this new reality where we've moved to more online, remote, and virtual sources of information and telehealth. I think partnerships and multi-sectoral approaches is key.
Thank you, Alexandra. And I think this is also why we're here with such a, different organizations coming together in this webinar, because we also see the importance of collaborating with different organizations. We know that the reality and the needs of girls are multiple, and we need to work together basically to support them on their needs. So just to continue with our questions, I want to now ask to my colleague Pansy. Pansy, I know that Ipas Malawi has been advocating with different stakeholders to ensure access to sexual and reproductive health services for girls and young women during the pandemic and beyond. You have, shared multiple examples with me on how you have been engaging with young people and also with different stakeholders to support their access to services. So I also want to hear, or I want you to share with us, or how COVID-19 has impacted girls in Malawi. Obviously, we heard from Eugenia, we heard from Alexandra, but if you can share a little bit more on what have you seen in your work in Malawi, and how you and your team in Ipas Malawi are engaging with girls and young women to ensure their participation in the COVID-19 response. Thank you, Pansy.
Thank you very much. Greetings from Malawi. As the speakers before me have said, in Malawi, to contain the epidemic, schools were closed, but also there were restricted services that were being offered at central hospitals to decongest the hospitals. So one thing that was suspended was youth-friendly services, which is one of the only opportunities that young people have to access sexual reproductive health and rights products, but also information. So the suspension of that, combined with prolonged periods of children at home, we saw that there were quite a lot of unmet sexual reproductive health needs, because the platforms that were available for young people to access information or products were suspended. But also we found that a lot of information did not include young people. Even the initial response plan that was produced actually left young people altogether, but also it was very silent on sexual reproductive health and rights. So as IPAS, one of the things that we did at health systems level was to try and bring services closer to communities. So we decongested central hospitals by supporting health centers that are closer in communities to make sure that at least essential sexual reproductive health and rights products and information remain essential and it remains undisrupted. We took our advocacy to the highest level to make sure that even services like post-abortion care should remain being provided in hospitals, and supported ministries closer to communities to start providing that. But one of the exciting things that I found really impactful was engaging young people themselves. We call them youth advocates, champions, who live within the communities, to start reaching out to fellow young people with information around COVID, because there was quite a lot of misinformation around COVID-19, and then also start sharing with their fellow friends information about sexual reproductive health and rights. And these champions are linked to health centers closer to their communities. So to manage what Alexandra shared about untruth around the epidemic, or a lot of information that is taking place, at least these champions were able to link with the health officials at the clinics nearby, so that the information that was being shared was honest and was truthful. But definitely there has been a big impact. We have had, the Ministry of Gender has had a rapid assessment that indicates that about 40,000 teenagers are pregnant, although schools have opened. Unfortunately, this group will not be able to go back to school. We have had over 13,000 child marriages. The government is working very hard to dissolve some of them, but definitely this is a direct, and you can attribute it to prolonged absence of children attending schools, being confined in small areas. There have been cases of high gender-based violence. So it has impacted young people in Malawi negatively, and we're trying to mitigate the impact by working with community-based organizations, women-led organizations, youth-led organizations, plus these champions, because they are almost the same age as their fellows. We find that the information is much more credible, and the fact that the champions are linked to health centers, at least we are able to manage the quality of information that is circulating around. So let me share that for now. Thank you.
Thank you, Pansy, for sharing, some of the strategies that Ipas Malawi has been using to obviously work with the community and directly with young people. Obviously, we have been talking about the importance of working together, and I also want now ask to Marina. WHO, UNFPA, and other agencies have been working together to produce gender-sensitive, inclusive, and evidence-based guidance on how to deliver an essential package of sexual and reproductive health interventions to adolescents. So I want to hear more from you on like what are those main recommendations from the guidance. Can you also share with us some of the best practices and lessons learned from working with different governments? I know that that's also part of your role with the WHO. So thank you, Marina.
Thank you, Cecilia, and thank you to Ipas for organizing this event, to the fellow panelists for your important remarks, and to panelists for joining us today. So thank you. In June, WHO published a document titled Maintaining Essential Health Services, Operational Guidance for the COVID-19 Context. It's an interesting document. The first half of it discusses general operational strategies for maintaining essential health services, things like establishing safe and effective patient flow, maintaining availability of essential medications, equipment and supplies, etc. And the second half of the document looks at specific life course and disease considerations. So for sexual and reproductive health, it covers access to contraception, fertility care, safe abortion care, cervical cancer screening and prevention, violence against women and girls, and menstrual health, as well as an extensive section on HIV. And for each of these items, it lays out recommended modifications for safe delivery of services and considerations for transitioning towards restoration of activities at different points in time. This is a really interesting document, but given the breadth of it, it was not possible to include detailed content on adolescent sexual and reproductive health. So for this reason, WHO and UNFPA collaborated to develop an additional technical brief titled Not on Pause, Responding to the Sexual and Reproductive Health Needs of Adolescents in the Context of the COVID-19 Crisis. Both of these documents are available in the handouts feature in this webinar, and I'm sure that we can share them afterwards as well. This technical brief, I really encourage participants to have a look at if you haven't seen it already. It lays out some overarching considerations and then uses the Lancet-Guttmacher Commission package on essential sexual and reproductive health and rights services, which includes CSE, contraceptive counseling and services, comprehensive abortion care, antenatal, interpartum, and postnatal care, HIV and STIs, gender-based violence, HPV vaccination, sexual health and well-being, and menstrual health. And for each of these areas, again, it sets out specific measures for delivery of services, monitoring and reinstatement triggers, and considerations for transition towards restoration and recovery. Some common themes across those various areas, and so of course they have specific recommendations for each of them, but some common themes include things like informing adolescents with different types of communication platforms like social media, hotlines, radio, television, printed materials, where and how to access sexual and reproductive health information and services, and including changes, if there have been any, to service delivery times, locations, etc. Another recommendation that's a bit of cross-cutting is to consider waiving restrictions if these exist, such as those based on age, marital status, or parental spousal consent to accessing services, and to consider trying to reduce the cost of services or even providing them free of charge if that's possible, given the economic impacts of the pandemic as well. Another is to consider establishing alternative delivery modalities for services that are more accessible to adolescents. So those might be through telemedicine, but they could also be through pharmacies or shops or community-based delivery points. So thinking through how can we get services to adolescents? And then similarly, how can we put in place outreach strategies when care seeking among adolescents has declined? For example, pregnant adolescents. If we know that we're not seeing them come into facilities, how can we go to them? These are just two resources of many. For example, UNICEF published a different guidance on mitigating the impact of COVID-19 on menstrual health and hygiene. So we encourage you to look at all of these. I know we have a short amount of time, but a couple lessons learned are examples from countries. So we're trying to ensure that these aren't just words on a page with the recommendations in the briefs, and we're working to collect case examples from organizations and from governments on how they've applied these recommendations so that they can provide inspiration to others who might be interested in doing similar things. So I'll be reaching out to Pansy for more information on the example that you shared from Ipas Malawi. Two examples I want to share with you. One relates to contraception, and it's from Love Matters India. Love Matters India launched a WhatsApp chatbot service called Ranjana to answer adolescents' questions about sexual and reproductive health, including contraception, direct adolescents to the nearest clinic that's providing adolescent-friendly services through their Find a Clinic feature. And then they also connect the user with the nearest peer educator who's already been trained on providing information and linking adolescents to services so that they can provide support to bring the young people to health facilities if need be. Another example is related to safe abortion care, and this is from the Sudan Family Planning Association, who established a new call center to increase access to safe abortion services in the context of the nationwide shutdown in April 2020. The call center is staffed by general practitioners and obstetricians who provide abortion and contraceptive counseling and consultations. The providers also then can provide referrals to services within clinics or by community-based providers nearest to the caller's place of residence. So we're not saying these are best practices or exactly what you should do, but they're just supposed to provide inspiration for ideas that we might be able to take on ourselves. Thank you.
Cecilia, I think you're muted right now.
Can you hear me?
Yeah, there we go.
I think this happens in every single webinar, no? That you're talking and you're muted. So I was just saying that thank you, Marina, for the inspiration, because I think that this is also what is something that we wanna do today, is to look for inspiration and also examples that will help in our work to continue working, to advance girls' sexual and reproductive health and rights. So today we also have Asiara with us. Last week, the Global Fund for Women presented its Adolescent Girls Advisory Council. So Asiara, we want to hear from you more about the council, because we think that this is a very inspiring model for organizations like Ipas and others. And we also want to hear for you, what recommendations do you have for other organizations that want to engage in meaningful partnership with girls? Thank you.
Thank you, Cecilia. Thanks a lot for having me. Greetings to everyone from rainy Kigali. So I'm very much thrilled to be here to talk to you about the Adolescent Girls Advisory Council. As Cecilia mentioned, so we last week were able to announce them officially to the world. But the Girl Advisors have been part of Global Fund for Women now since January of this year. And I think just to give you some context, I would like to tell you a bit about just Global Fund for Women and the reason why we decided to form this advisory council. So Global Fund for Women is a feminist fund and a global advocate for gender justice. So we support gender justice movements globally, including movements that are led by girls and young women in all of their diversity. And we also support intergenerational movements. So we deeply recognize how crucial having intergenerational solidarity is to successful feminist movements that we are supporting worldwide. And the Advisory Council, the Adolescent Girls Advisory Council, is actually a key component in our efforts and commitment to shift power to girls and to young women. So the Advisory Council is made up of 12 incredibly powerful, amazing adolescent girls who are aged between 15 and 18, and they represent 12 countries across the regions worldwide. So we have girls from Algeria, Afghanistan, Brazil, Cameroon, the Gambia, Mexico, Mongolia, Nepal, South Africa, Ukraine, and Zambia. So you can imagine every girl has her own experience. Every girl actually, just to also indicate how we were able to select them, we actually made an open call inviting girls, again, in all their diversity, so girls from the Global South and Global East to apply, and mentioning that we were looking for girls between the ages of 10 to 17 because we were very intentional in recruiting adolescent girls and making sure that they're part of our governance. So the open call went in different languages, so French, English, Spanish, Portuguese, and Arabic. And so some of these girls that were selected in January, some of them are actually connected to some of Global Fund for Women's current grantee partners. Some are connected to feminist groups, to national children's rights organizations. Some are running Girl Up clubs and different networks in their country. Many are actually youth advisors for different development agencies. So quite a variety of backgrounds. And we also have one girl who has written her own feminist book, which I think is just amazing. Anyways, so the girls are playing various roles within Global Fund for Women. So they play a role in grant making. We just finalized our first participatory grant making with the girls. They were able to identify, well, to select 8 girl-centered and girl-led programs, organizations, I should say. They also took part in developing our strategic plan, so for the Adolescent Girls Program. And honestly, we're just so eager to have them take part in various aspects of our work. Again, just a reminder, they've been part of the council since January. What's really incredible about the girl advisors is that they're using their power, they're using their voice to tell us what girls need. So one thing that I truly appreciated when we were going through, well, the girls were going through proposals and making decisions about the groups to fund, is just how intersectional they are and how just, yeah, the collaboration that, how they were working with one another, really listening to each other, listening to everyone's opinions, and it was just amazing. And they actually created their Sisterhood Pact, which is a set of values that they want to uphold within the council amongst each other. But yeah, just a wonderful experience. I think having the girls being part of the advice of Global Fund for Women, you know, showing us their leadership, showing us how powerful they are, that they can actually find groups, they can fund them. So a wonderful way to see them expanding. And I'll stop there, but really happy to answer any questions from panelists and those who are joining us as participants. And one thing, I guess, as recommendations for Global Fund for Women, so I was thinking about this. I think just being committed to listening deeply to girls, I think that's really important. Very often girls are erased and infantilized, and you know, but recognizing that they are girls, they're living the experience of being an adolescent girl, and so they know what they need, and they can express it, and they're experts and they're teachers. I think that's really important. And this applies to any of the communities that we are serving. So it can go beyond adolescent girls. It can be also adolescent boys. And then the reality is that girls are organizing in their communities, in schools, in clubs. And so just they're already pushing against different oppressions that they're living. And so creating that space for them where they can share their experiences, their recommendation, I think it's important. Another thing, I guess, as a recommendation that I have is just, centering girls in a way that's cross-cutting. So within our organizations, within our systems, so involving girls in decision-making, involving girls in, so I shared the experience of the girl advisors taking part in participatory grant making. So that's really a way to ensure that girls are making decisions. I feel like there's so many, but I would also just say making sure that girls have a space for them, for their autonomy, which is protected. So making sure that we are also creating opportunities for them, but also making sure that we have healthy boundaries, making sure that we have a rights-based and a feminist safeguarding policy in place to ensure that not only are we keeping them safe, but we're also creating opportunities for them to show up in their full power. I think that's really important. Acknowledging the ways that girls work and the way that they organize, they show up. We just heard how they show up digitally, and their activism is very much online. So I think just acknowledging the ways that girls are showing up and meeting them in that space, I think is really important. I'll just stop there, but I guess just one last thing is that I would recommend, in addition to having the safeguarding policy, it's to compensate girls in a way that recognizes their time, their knowledge, their skills, their expertise. So really I guess this is the feminist approach of not being extractive. So those are just some recommendations I'd like to share from our experience at Global Fund for Women. Thank you.
Thank you very much, Asiata. These are great recommendations, definitely, that we can learn a lot, from the work that we are also doing. But I think it is, for me at least, it's really exciting to hear how organizations like the Global Fund for Women are working directly with youth-led or girls-led spaces and groups, because I personally have seen, in countries like mine, in Nicaragua, where the difference that the feminist funds can make in the work of community or small organizations. So I think that this is great. And I think this is also very important, because we have seen a lot how the donor community, governments, even NGOs usually don't prioritize the needs and rights of girls. And as you have been sharing, obviously the COVID-19 pandemic makes this reality even more complex. But as a community, we also tend to work in silos. We work on abortion, or you work on to prevent HIV, but we don't necessarily collaborate, or we don't necessarily work together. Obviously, there are great examples. There's a lot of inspiration that we can also learn from. But I want to ask you, all of you, how can we build collective power, to advance girls and young women's rights during the COVID-19 pandemic, but also beyond this? Because obviously we're seeing different trends. We've seen how the impact that this COVID-19 is causing, but how can we also think about, for the future? So how can we build this partnership, this collaboration? What recommendations will you have? So maybe we can start with Eugenia, just so we go again on the same order.
Well, I think that I will start with Aisata's last idea of not being extractive, and also this idea of keeping opening spaces that are safe, but also that inspire for meaningful participation. No, we need to strengthen the autonomy. We need to understand evolving capacities in a way that is due to empowerment and not to constriction and limitation. I think that we need to listen to the adolescents and the girls more, and to understand better what are their context and what are their needs. We have been working with a group of young leaders in Latin America. They come from around 10 countries, and they did a campaign on COVID just because they thought that the policymakers were not hearing enough voices from them. No, so they have different ideas. We need to stop being adultocentric, and we need to start listening to them and just put the space and make the space for them and the resources to support them. I think that's, I mean, it's just one sentence, but it's very difficult, and we're very, I don't know, in the starting of this journey to really understand what does it mean.
Thank you, Eugenia. Alexandra, do you have?
Yeah, thank you. I was just so excited to hear about the Adolescent Advisory Council and the way you talk about them. I can feel the excitement. I have 2 points maybe to raise on this question. The first one being that we have to look at the root causes of inequality and really drill into the social norms and work with all members of the communities in order to create the space where adolescent girls are actually listened to and taken seriously. So working with men and boys, of course, but parents, caregivers, grandmothers, religious leaders, traditional leaders, teachers and healthcare providers, etc., to unpack the harmful social norms that place girls in this position where they're not listened to. And the second one is, of course, the multi-sectoral approaches and stop this very siloed approach that we tend to work in the development of humanitarian sectors in order to really meet the sort of interconnected and multiple sort of needs of an adolescent person. I think that it's quite, even the fact that we're having these conversations over and over within the sector is a symptom that it's something that the sector has created. If you would ask an adolescent girl about what she needs, she wouldn't start talking about the health sector and the education sector, and she probably wouldn't use the abbreviation SRHR, etc. So it's something that we have to fix from within also to stop being so siloed and really place the people who we serve at the center and ask, okay, what solutions can we find? What are the issues? And yeah, stop the siloed approach.
Thank you, Alexandra. Pamsi, do you have anything to share with us?
Yes, I think the starting point is that we have a responsibility to safeguard the rights of girls, and those rights include sexual reproductive health and rights. Usually our responses, girls are not even given space or platform to share their views. We make these decisions for them. We are talking about COVID-19 epidemic. Some of our countries are exposed to other type of disasters, be it floods, be it droughts. So there has to be deliberate effort to make sure that girls, adolescent girls and young women interests, especially those around sexual reproductive health and rights, are given priority. And allocated resources, the same way we deal with the in-kind support when a disaster struck. Girls and the sexual reproductive health needs of girls and adolescents should not be the last added, activity. So for me, I think we have a responsibility to put them in front, to safeguard their interests, to engage with the policymakers, that, sexual reproductive health and rights remain essential, because even when there are disasters, there are still sexual reproductive health needs. And if they are always going to come last after responding to the mainstream emergency in courts, then we'll never win this. So for me, I think moving forward, we really need to, when we're looking at any proposal, any response, we need to ask ourselves a question: what in this response is there for girls? How are we addressing girls and young girls' sexual reproductive health and rights needs? Because we are going to be at risk of perpetuating poverty. I was talking about Malawi losing 40,000 school-going girls to teenage pregnancies. And yes, they may go back to school, but it creates a lot of challenges. So I think it's to be deliberate to prevent and safeguard their interests from the start. I'll stop there. Yeah.
Thank you, Pansy. Marina?
Thank you. So COVID-19 is a massive challenge, and it's disrupted all of our lives and brought hardship and tragedy all around the world. At the same time, in some ways, COVID-19 has presented issues like adolescent sexual and reproductive health an opportunity, especially issues that are sidelined or stigmatized even in normal times. And the reason for this is that everyone, no matter the health or development area that they focus on, is having to rethink the ways that we're working, reevaluating what is most essential, how are we delivering information and services, and importantly, having to check in with the groups that we serve to understand what they're going through, what their needs actually are, and how we can meet those needs. And working with adolescents on sexual and reproductive health, we have to be creative and responsive even in normal times. We have to think out of the box in how we can understand what adolescents' needs are and respond to them effectively, whether that's through digital sources or mobile clinics or community outreach. This is our bread and butter. And there's a thirst from lots of different areas to learn. And this is an opportunity for us to share our work, put adolescent sexual and reproductive health in the spotlight, and see how we can break down some of these silos. One example from our own organization, WHO, every week we have a briefing with our regional counterparts. And this includes people working on maternal, newborn, child, adolescent health, a range of issues. And in one of the sessions, we arranged for GAGE, the Global Adolescent, Gender and Adolescence Global Evidence Group, to join us and to present some of the very early research they were doing to understand the impact of COVID-19 on adolescents and especially their sexual and reproductive health in multiple countries. And this was this was early on in the pandemic. And our colleagues who don't work on adolescent sexual and reproductive health were fascinated by the findings because it was some of the only evidence available at the time. It brought an issue that typically would receive little attention to the forefront, and other areas wanted to learn from us how they could do similar work and work with us. So while this is a really difficult time and we don't want to minimize that in any way, we can also try to find ways that this is actually an opportunity for us and for adolescent sexual and reproductive health and rights.
Thank you, Marina, for the examples. Asiata?
Thank you, Cecilia. Sorry, I had muted. So I guess I'll echo what my colleagues have said. One thing that I want to mention, when we look at, for instance, if we take the example of feminist funding principles, where the funding is flexible, we provide co-funding to organizations, and we let the groups, the grassroots organizations, decide how best to use the funds. And so it's really the way we do the funding, especially now with COVID-19, with crisis grants, we make sure that the organizations, which, in their response, which is gendered, that they are the ones really identifying what their communities need and how best to use the funds, So I feel that there's a there's a, how can I say, bottom-up approach to the work that we're doing. When, in comparison maybe sometimes to humanitarian organizations that tend to be more of top-down. So I think I totally agree about kind of removing this barrier that exists and makes our work so siloed. But also I think there's value in learning from best practices from different organizations in different sectors, in how they do the work in a way that is empowering for the organizations, the communities that we're supporting, and in this case, making sure that girls at the table, that girls are determining how, whether it's funds, whether it's the, the response to COVID, because they're already at the forefront, they're already organizing, they're taking part in the response to COVID in their communities in different ways. So it's just recognizing already the power that the communities and the girls have, and really finding ways that kind of uplift that power that they have. So basically what I want to say is just learning from other partners and the way they're doing to ensure that we're also breaking the top-down approach to our work, but really centering our work and yeah, in the groups and organizations, girls that we're supporting. I also agree about working with allies, girls allies, so that the parents, religious leaders in the communities, boys and men. So just echoing and just stressing that in addition.
Thank you, Asiata. So I also want to invite the audience or colleagues who are joining us today to share their questions. We also have a comment from Judith Delange. I hope I'm pronouncing your last name correctly. Judith, she's saying that it's great to hear the examples from of Love Matters India, and if you want more information, please reach out to me. I'm the project coordinator at RNW Media, the founders of Love Matters, so I can definitely connect you with other colleagues. So Marina, if you're interested, we can definitely find Judy's email and make the connection. So thank you, Judy, for your comment. And if others have questions, please type them on the chat box, so we can also post them to our speakers. We have about 25 minutes left on our webinar or session. So this is going to be a good time for us to receive these questions from you. But also I want to invite our speakers. If you have questions for each other, I think this is also a good moment to ask them. I know that we also want to foster the connections here. So feel free to also ask your questions to each other if you have any. I don't think I see any other question for the audience, but I hope that people are getting their questions ready. So yeah, Megan is telling me we don't have more questions at this time, but so I will continue, but feel free to add your questions or to just let us know if you have anything. Before I move to another question, I just want to mention that you're going to see that we have some documents that Marina shared with us. So I think that we can also send them after the session, so everyone also have access to them. But you can find the documents in as part of like the handouts of this call. So So obviously we have been talking a lot about the importance of working together, breaking those silos. But also we have heard about the opportunities that even this difficult context brings to us. Is like not only for working together, but at the same time, opportunities to think about the future and to also, you know, just think about like what are those policy considerations that we need to have at this moment. Obviously, COVID just in some way makes deeper the issues that we were facing before COVID-19 became a pandemic. But I want to ask everyone in this panel, it's like, what recommendations do you have for specific policy considerations and practical actions? I know, for example, Eugenia, in the work that Girls No Brides, you also have been doing, even before COVID became an issue, reviewing a lot of like the policies and the impact that this has for girls. So what recommendations will you have considering our current context?
Well, one big one is to make sure that the social protection programs are really targeting girls, especially those that are married or pregnant or at risk of marriage and pregnancy, and including those that are suffering gender-based violence. No, I think that this is a very strong topic in Latin America as well. We need the governments to make sure that the impact that the epidemic is going to have and is having in the economy can be balanced, and to keep girls, as I said before, in education, whatever that means. If the schools are closed, to make sure that there is education through television, to radio, or at the community level, we need to make sure that that's available. The other part is the access to health. And we know that sexual and reproductive health is needed, including abortion, but there is the other part of health, which is not the sanitary emergency, is also needed. So we need to ensure that some of the medical facilities are available to provide the other services that girls need. And we need to ensure that there is a plan for economic empowerment for adolescent and young girls, to make sure that the care work and the domestic work that they're doing now is not going to be a limitation for developing as a professional afterwards. We know that education is a protective factor, and we know that we need to keep girls at school, and we need to keep them having good opportunities. And I also wanted to say that we need to increase the investment in adolescents. And we have spoken with Aizat about the flexible funding for organizations, but we also need to have budgets that are targeting specific actions for girls. So many countries have national plans that are intersectional for addressing child marriage or for addressing early pregnancies or violence. And we need to take advantage of those spaces that are already in place to make sure that they have the money budgeted that they need to the costs that are going to be needed for these policies. And finally, I just want also to say that one big request from girls that we have been hearing is to pass from intergenerational dialogue to intergenerational action. And I think that we need to have this in mind as civil society organization, as donors, but also as governments. We need to open space as the Adolescent Advisory Council to have in the countries, in the governments, this kind of mechanism that ensure that adolescents and girls are consulted when the designing of policies is done. Thank you.
Thank you, Eugenia.
Comprehensive sexual education. I didn't say it. The package on education. Sorry.
No problem. Thank you. I'm sure this is also going to come up. But Alexandra?
Yeah, I was also going to add CSE to that long list of very good considerations for policy and practice. A couple of quick things to add to that great list. Humanitarian action and an inclusion of SRHR and the full and swift implementation of the minimum initial service package, which is not fully seen as a life-saving intervention by all humanitarian donors and actors. And this is a huge gap. And we also know that the SRH services that are available in humanitarian contexts are often not age and gender responsive. So adolescent girls in particular sort of fall between the cracks between child health and health services for women. And this is frankly unacceptable, knowing the impact it can have. Second, I would also like to say something about the need for policy and practice to take into account the very diverse experience among young people and among girls, and that adolescent girls are not a homogeneous group. And there are vulnerable groups within vulnerable groups, and that policies and practice must be flexible enough, but also targeted enough to create space for these most vulnerable groups. Taking an intersectional approach to age and gender, I think is key for everyone, whether it's a government or an NGO or a UN agency. I think that's critical. But I'll stop there because I think you said some good things, Eugenia. So just 2 additions from my side.
Thank you, Alexandra. Pansy?
Yeah, no, very good points have been raised. I think to add to that, as Isata said, in communities, you already have organized spaces for girls, for adolescent girls, for young women. I think it's just to support them and recognize them. I think sometimes we confuse them by creating parallel structures. I think they already have culturally accepted platforms that they already use. So I think let's use what is existing, because there's already trust that exists within that group. Another addition, I think a new one, would be we're moving into a space where there's more use for digital platforms, but data may not be easily accessible. There's maybe those in urban areas will be able to access, internet, whereas those in rural areas may not have that access. So it's to appreciate the different platforms, but we're still going to be needing, our governments to take issues of ICT seriously and make data cheaper and accessible to all. Because if we don't, then there'll be a big group of people that will be left behind in terms of accessing information because of data costs. So I think it's to appreciate technology as the way forward. And I know different countries at different levels, but we need to be deliberate that the future might also include digital platforms. How can we protect the young people? I know in Malawi, Plan has just launched some issues of data harassment using social platforms. As we move forward, how can some of the countries or those of us who have not taken that approach learn from our other organizations, so that as we develop our infrastructure, we take into considerations learning that is already coming from organizations like Plan. So those are the 2 additions that I have, but definitely an issue around the social protection for adolescent girls and young women. A lot of girls are driven into extreme coping structures, coping mechanisms, just because their needs, their physical needs, their livelihood needs have not been addressed. So I think as we move forward, it's very important to ensure that they also are deliberately targeted for social protection programs. Thank you.
Thank you, Pansy. Marina?
Thank you. I'm going to make 3 points because there's already been so many useful inputs. The first is that there's already so many barriers and challenges at the moment. So we need to make sure that the last thing we are doing is creating additional unnecessary or harmful barriers that further challenge adolescents. So specifically to health, this means, do we have age restrictions? Do we have marital status restrictions? Do we have parental or spousal consent requirements? Do we have high fees for accessing services? What can we do to remove those in these exceptional circumstances, and then see how we can transition that into the future as well? School reentry. How can we make sure that school reentry is inclusive? So it's not exclusive of those who have become married, who are pregnant, or who have had a child, for example. The second point is about our discourse and communication. There's a lot of really worrying discussion in the past few weeks and even now in the news about how young people, adolescents, young people are the problem with COVID-19, and that they're the ones that are responsible for the increasing levels of spread that we're seeing in many parts of the world. We really must confront such discourse. Certainly there are adolescents and young people that are going against the policies or protocols that have been put in place, but there absolutely are adults who are doing that as well. And as Mike Ryan, the executive director of the WHO Health Emergencies Program, recently said in one of the briefings, the last thing a young person needs is an older person pontificating and wagging a finger. It never worked with him, it never worked with me, I'm sure it never worked with all of you. And this echoes the lessons that we've learned from decades of research on other issues like HIV, for example. And instead, we need to find better ways to engage with young people, give them the opportunity to have a responsibility and a voice in this, empower them and resource them to do it. And this is fully in line with this year's theme of International Day of the Girl. The third, and this is along the lines of out-of-the-box thinking, could we all just sit and imagine for a moment a world or what this field would look like if organizations reallocated all of the funding that we typically use for travel that's not possible to use in the context of COVID-19 to compensating young people in every part of our work. I'll leave that there.
Thank you, Marina. I think that's it's a great idea. It's like Pansy was asking, like, you know, it's like how much of the money do we really put on, you know, an inner work with girls? So definitely a call for everyone here to think about how can we better allocate funding for the work with girls directly and to compensate their contributions to the work that we all do everywhere we work. So Asiata, do you have?
Yes, so I guess I wanted to share some examples of what some of our grantee partners are doing and how intersectional their response to COVID-19 has been. So we've realized how COVID-19 has also been weaponized. So if you take examples of what's happening in India and how the COVID response has been there has been a response that has targeted for instance, the Muslim communities. So some of the grantee partners who, in their response to COVID-19, are taking into account the violence that's also stemming from racism. In some places, like in Brazil, we have grantee partners who are working on the anti-Blackness and the violence that Black communities are experiencing, either from the police or forces of, police. So I think there's also, there's that we need to look at, looking at groups that are working in an intersectional way, looking at groups that are providing response to COVID for the LGBTQI community. So I feel like we've mentioned it. I know, Eugenia, you mentioned the intersectionality of the response. I just wanted to emphasize that and just give some examples of how grantee partners are responding. in addition to some innovations, them, like running helplines for victims and survivors, or just using the online platforms to respond to COVID, but also have a response to the brutality that, for instance, is happening in some of the areas due to racism. I hope that is helpful.
Thank you, Asiata. I see, Eugenia, you're raising your hand, but go ahead. No problem.
No, sorry. It's just that I think that what Isata is saying is very, very important. The organizations, feminist organizations at the local level, they are the ones responding. They are creating safe spaces, support spaces, even counseling, even developing manuals for others to do the same. So I think that we need to acknowledge this and to give a special recognition of that this is, they are the one leading the response now. So yeah, sorry.
No problem, and thank you. I agree with you. It's like the issues that are usually not addressed by anyone else are the feminist organizations definitely raising those issues and make them visible for everyone. So so I see that we only have 8 minutes left. I don't see any other questions coming from our audience, so I hope that people are really listening and taking notes of all the amazing recommendations that we have hear from our experts here today. So just to close and have final messages from our speakers today, I want to ask all of them to share with us their main takeaway from our discussion, so we can also take those messages with us after we close this session. So just to continue with the same order, or if anyone wants to start, that will be great. Just so, Eugenia, we don't put you on the spot again. So.
Well, I can jump in then.
Yeah, excellent. Thank you, Alexandra.
I think that my main takeaway from all of the other panelists today as well has to do with the sort of the digital inclusion, and thinking that we're in a phase right now where virtual and remote and digital solutions is something that we're going to have to deal with. As our report for this year's International Day of the Girl Child shows, online spaces aren't safe spaces for girls, and that needs to be addressed. But really to ask and listen and hear girls out, to identify where these gaps are and challenges, so that we can design, I don't know if we can call it digital solutions, let's call it digital solutions together with girls to also fight the barriers. I think that's what we need to do right now, in real partnerships and not tokenist partnerships.
I think that my main takeaway is to think out of the box. I really appreciate Marina's challenge on how can we, invest more and and think out of the box, and how can we put that money in data and in the participation of young people directly, and in adolescents councils for everybody. So I think that we need to really get out of our roof and break it.
Yeah, I think for me, building on what she said, is let's move from dialogue to action, and let's put the girls at the center of COVID response, but also other humanitarian crises that may occur in future. How can we, as Marina has challenged us, look at the COVID-19 as an opportunity to recalibrate the way we do our programming? Yes, it's a difficult time, but how can we take the opportunity to reflect and maybe improve the way we work with adolescent girls and young women. Thank you.
Thank you, Pansy. Asiata or Marina?
For me, that girls
So
need to be at the center. Go ahead, Asa.
No, it's okay. Go ahead. Go ahead.
Okay, that for me, I really appreciate all of these reflections, and that for me, the key message, and it's wholly in line with this year's theme of My Voice, Our Equal Future, that girls need to be at the center of everything that we're doing with meaningful roles and responsibilities, not tokenistic contributions, and that they need to be acknowledged and compensated fairly for their contributions. Thanks.
Thanks. So I was actually going to say what Pansy mentioned, and something that Eugenia mentioned of moving from intergenerational dialogue to intergenerational action. I love that. And that's definitely something that we are seeing in the movement that we're supporting, including movements, for abortion rights. So I think that's a nice call for action. I think also just in relation to the digitalization, I guess, of what we're seeing right now, how we've moved to online work. I feel like we also need to think about the girls who are the hardest to reach. And again, this goes back to seeing how we can support grassroots organizations that really at the forefront of the response, and and rebuilding. Really, I think this is a moment for us, an opportunity for us to build something that's more equal and just.
Thank you very much to all of you for your takeaway messages. I think that we are very inspired today from the this conversation, and definitely a lot to think about, especially in our work that we're doing in each of one of our organizations. So thank you everyone for your attendance, especially thank you to all the speakers, and let's continue this conversation online and also offline, so we can continue to advance. And definitely this is a call to take our dialogue also with girls directly, so we can also take action. So thank you, everyone, and I hope to, continue this conversation. And yeah, thank you, Judith, and all for your attendance.
Thank you.
Thank you. Thanks so much.
Thank you.
Thank you.
Thanks, everyone.
Thank you. Bye.
Bye.